Hello everybody, this is David Parker with Parker Insurance coming to you with another snippet of how does this insurance work. I'm going to walk you through real quick how Your Health Idaho would work. This is at yourhealthidaho.org. We start shopping for a plan. I'm going to plug in my zip code here in Rexburg, 83440, and then I live in Madison County. I'm going to just put it in here, a birthday. Someone of my vintage. How does that sound? Ooh, that's getting to be old. And then I'm going to put in an income. So what I'm going to do here is I'm going to put in an income that is about 185% of the federal poverty level. So there's a number of different cost share levels, and I'm going to put in for a single individual $22,000. Okay? Because we make lots of money selling insurance, right? So that's what we do. Put income in at $22,000. At $22,000, what I pay for insurance at $22,000, I am about 185% of federal poverty level. At 185% of the federal poverty level, what I pay for insurance is somewhere around 5% of my income. So 5% of my income of $22,000 is $1,100 a year. Divide that by 12, and I come up with a $91 premium. How does $91, what does that buy me? So I go to Your Health Idaho and I plug that in. They offer a platinum, gold, silver, and bronze plan here. Okay? What I'm going to do is go to the silver plans, and now we have a tax term called second lowest cost silver plan. So I'd calculated 91. The percentage I calculated was off a little bit. My benchmark amount is $100. That is what I would pay for my second lowest silver plan on the exchange. The actual cost for that plan is $650. I subtract this $100, and then that gets me up to where now I've got a credit of $550. This is how much the federal government sends to the insurance company every month on my behalf. Then if I go down here and I buy the cheapest thing I can get, which is a bronze plan, it costs me nothing, because the actual cost of the plans are less than my $550 tax credit. You'll see here in Madison County, our least expensive bronze plans are from Blue Cross of Idaho. You'll notice all of them are a POS plan, and I've addressed that in another video if you want to look at that. Okay? Then if I come back here to the silver plans, they have done something really special. If I grab this Access Care Silver plan from Mountain Health Co-op, here in Rexburg, it had a $3,500 deductible, but because of my income, they've reduced it to $300. Yes, a $300 deductible. After that, the insurance company pays 90%. They pay 80%. You pay 20% until out of your pocket, we're at $2,450. So the way that works is I pay the first $300. And then after that, I go to co-insurance. So if I come down here and look at the outpatient surgeries, is where often I'll look for that, I would pay 20% after the deductible's met. So I pay the first $300, then I pay $20 until out of my pocket I hit $2,450 total. Now that $2,450 is going to include everything else we go over below this. So below here, I have a doctor's office visit that's a $25 copay. To go see a specialist is $40. No charge for preventive care on every plan. They are supposed to cover wellness exams and preventive care at 100%. Okay? Then the other things covered, everything after this, you're going to see 20% co-insurance. After I meet that $300 deductible, co-insurance is the percentage I pay while the insurance is paying. So they pay 80%, you would pay 20%. Okay? That says 20% co-insurance after deductible. So this includes labs, x-rays, MRIs. Prescription drugs are $5 for generic drugs, 25% for preferred brand, and 30% for non-preferred brand drugs. They have a list of preferred ones. If they're not on the list, they're non-preferred, and they may cost you more. As we go down through this list, again, it covers all of those: outpatient surgery services, emergency room care. There's an extra copay if you go to the emergency room. That's $350. Emergency ambulance services, urgent cares, hospitalization, mental health services. On this one, a counseling visit would cost you $40. Inpatient mental health services is 20% after the deductible. Substance abuse disorder outpatient and inpatient services would be covered there. Maternity covered the same as any other illness. Other special needs would be home health care services, outpatient rehabilitation, skilled nursing facility. Chiropractic care is limited to 20 visits a year. Very rich benefit for chiropractic care. Most of our plans cover that. Physical therapy is limited to 20 visits a year, and dental is covered if you get your teeth knocked out in an accident. But I wouldn't recommend getting your teeth knocked out in an accident. Very uncomfortable. Okay, so cost-wise, that would cost me about $100 a month if I'm a single individual making an income of $22,000. So if everything below there, again, hits $2,450, that is my out-of-pocket maximum, then above that, they cover 100%. Okay? If you have more questions about how this works, feel free to give us a call at Parker Insurance at 208-356-0009. We think nothing says fun like insurance.